This Spotlight on Long-Term Care is sponsored by Game Plan Financial. Every game has a winner, every winner has a game plan. For more information, please visit gameplanfinancial.com. A recent study by Life Plans Inc. discovered few examples of private long-term care insurers wrongly denying claims. The findings came as part of an LTC insurance claim determination review that was commissioned by the U.S. Department of Health and Human Services, or HHS. A group of registered nurses from Life Plans looked over approximately 1,200 claims submitted between 2007 and 2008 to 7 LTC insurers, but could find few examples of wrongly denied claims, according to researchers. While insurers approved most of the claims submitted, auditors focused on a large number of denied claims in order to improve the credibility of their data. They found that they would have denied approximately the same percentage of claims that the carriers did, and would have approved around 5% fewer cases. Meanwhile, in 5% of the cases, the auditors said they could not come to a conclusion on whether the claim was wrongly approved or disapproved based on the available information. According to researchers, the potential maximum liability for all initial approvals by the insurers came to about $156 million, while the total potential liability for all denied claims totaled $60 million. Finally, the liability for claims the auditors would have approved was approximately $720,000. Caring for a loved one often takes a significant toll on retirement savings, according to a recent survey conducted by Genworth Financial Incorporated. Genworth surveyed 818 U.S. consumers ages 25 or older who were either recipients of long-term care or had a family member who was a recipient of care for 30 days or longer during the previous year. The study divided respondents into two groups: primary caregivers, who were the main providers of hands-on care, and secondary caregivers, or those involved with care but who did not provide day-to-day support. Of those surveyed, 73% of primary caregivers and 40% of secondary caregivers said they had cut back their contributions to savings accounts due to caregiving responsibilities. Meanwhile, 80% of primary caregivers said they had reduced retirement contributions, with 55% of secondary caregivers having done so. 65% of primary caregivers and 22% of secondary caregivers have also had to diminish their 401k contributions. Finally, approximately 44% of primary caregivers and 29% of secondary caregivers said they have had to reduce their number of work hours as a result of caregiving requirements, while 48% of primary caregivers and 42% of secondary caregivers said they have lost jobs, changed shifts, or missed career opportunities due to their additional responsibilities. Long-term care residents are hospitalized too frequently, often for reasons that could be prevented, according to a recent report titled "To Hospitalize or Not to Hospitalize" from the Kaiser Family Foundation, or KKF. The study examines the factors playing into high hospitalization rates among long-term care residents, based on interviews with physicians, nurses, social workers, and family members of residents of long-term care facilities. LTC residents account for a disproportionate amount of Medicare funding, according to KKF, with 1.7 million Medicare beneficiaries in long-term care during 2006, accounting for approximately $14,538 per person, or more than twice the average expenditure of all Medicare beneficiaries. Services covered by Medicare for LTC residents include visits to the emergency room, hospitalizations, and other medical treatments. Possible solutions offered in the report include increasing the number of staff members, providing more medical support, and a shift away from considering hospitalization as the first option. Doctors and staff members often assume that family members prefer aggressive treatments for patients, when that is not always the case, the study said. Other factors contributing to the tendency to default toward hospitalization include a lack of qualified staff members, protocols, and license restrictions. For more industry spotlights, visit producersweb.com.